Good afternoon and welcome to the daily afternoon update here in St. Clair County. As we continue to tell you that we do these updates at 3:30 every afternoon or approximately around there. Today we're on time. We have some officials with us today that's going to be bringing you some updated information as we continue to do these updates, as we continue to remind you. This is to help keep you updated on the situation here in St. Clair County. And today I'm joined with our Executive Director of the St. Clair County Health Department, once again, Barb Holt. Barb, welcome again today, and I understand we have some information that you're going to give to us.
We do. We have some updates. This afternoon during the governor's press conference, he announced that we have a third positive case of COVID-19 in St. Clair County. We expect these numbers to be rising because as testing continues throughout not only Illinois and St. Clair County, but throughout the nation, we expect these numbers to rise. From yesterday till today, the Department of Public Health reported there's 288 positive cases in Illinois. That's up from 160 cases yesterday. So the numbers keep going up. Additionally, our neighboring counties, Madison County reported their first positive case yesterday, as well as now there are 3 confirmed cases in Clinton County. So again, we expect these numbers to continue to grow as we have more opportunity for testing, but we want to make sure people stay vigilant, follow the rules as the governor has laid out. We've closed bars and restaurants to keep people at home, away, 6 foot away, social distancing, making sure we're trying to break this chain of transmission in St. Clair County. So again, restaurants have been closed. However, they are allowed to do carry-out and drive-through business. But wherever you're at, grocery stores are still open, pharmacies are still open, banks are still open. Please be aware to make sure you properly wash your hands and disinfect even as you go out into the public. With more updates from St. Clair County, I would like to introduce the chairman of St. Clair County, Mr. Mark Kern, with other updates we have, sir.
Thank you, Barb. And our thoughts and prayers go out to the latest person diagnosed with COVID-19, as well as those that have already been announced. These are trying times, and while we expect these numbers to go up, we can make a difference, and we can make a difference by staying home, if at all possible, only going out when you have to, staying away from people who have immune systems that aren't up to snuff. Those type of things can really do a great deal during this crisis. In order to conduct necessary business in the county, we will be holding our county board meeting tomorrow night as opposed to at the end of the month. We're going to hold it a week early. It's a special county board meeting. It's been advertised. The agenda is up on our website. And the governor has made it possible for many county board members to have the option of calling in by telephone. So we should be able to conduct it with proper social distancing, the 6-foot requirement, and keep everyone safe. At that meeting, we'll be addressing the extension of the emergency declaration that we made about a week ago. The county board will vote on that, and we'll extend this hopefully through the duration of this crisis. Tomorrow we'll also, as we do every year, we'll abate real estate taxes in St. Clair County. This year, actually, our rate will be decreasing a little bit. Also, we'll have other essential business that we've got to get done because we won't meet again until April 20th. So take a look on our website at the agenda if you're interested. It has been advertised, and so we'll get this meeting done, and then we'll have over a month for people to be able to stay home and try to contain the spread of COVID. Tomorrow, we're also going to roll out a new plan to serve the public during this crisis. We plan on closing the county building to the public starting Monday, but essential services will continue. All departments and arrangements for services will be detailed on the St. Clair County website on Friday after we roll this out at our county board meeting. And starting Monday, switchboard hours will be extended from 6 a.m. to 6 p.m. to answer any questions you might have about, is this service still available? How can I arrange for a marriage license? How can I continue to live my life as normal as possible during these times? Those questions can be answered. And the courts remain open. Essential court matters and proceedings shall continue to be heard by St. Clair County, Illinois courts. If feasible and subject to constitutional limitations, the court encourages the use of remote means such as telephone, video, or other electronic communications to conduct emergent matters and procedures before the court. All non-essential court matters are hereby continued. The court will be open on a limited basis for criminal felony, domestic violence, non-status DUI matters, and emergent juvenile issues only. We have a combined courthouse and county building, so it makes our life just a little more complicated during times like these. So we will keep the building open for the courts. The offices, there will be limited access for the public, and we will be closing the county part of what we do to the public during this time. This morning, Governor Pritzker came to St. Clair County to our health department in Belleville to brief the public on the state of Illinois' response and give us updates on the statewide situation. And he also again offered and reiterated the state's support for the citizens of Illinois during this crisis, and we appreciated him coming here. And so, as always, remember, it just takes a moment to spread this virus from one person to another. But we can break that germ cycle by washing our hands often and for 20 seconds. And always wash your hands after sneezing, coughing, handling food, or going to the bathroom, just like we've always been taught at home. And if you can't wash your hands, use hand sanitizers that have at least 60% alcohol content. Together, we can minimize the spread of this virus, and we can get back to our normal daily lives as soon as possible. Later on this week, on Friday, remember, on this live feed, we'll have the base commander from Scott Air Force Base detailing what's going on at Scott. And tomorrow, Dana Rosenzweig will be here from St. Clair County Mental Health to talk about how children need to be talked to during this time and what other mental health issues there are. I look forward to the rest of this program today. And Barb's got an exciting announcement to make on who's joining us. So thank you, Barb. Thank you.
Thank you, Chairman. Again, we're fielding a lot of calls from the general public and our medical providers and our hospitals and emergency rooms, and so we're very pleased to have a special guest today, Dr. Omar Badaman. Dr. Badaman is a board-certified infectious disease specialist in Belleville, Illinois, who's affiliated with BJC Medical Group and Memorial Hospital in Belleville. Dr. Badaman received his medical degree from St. George's University School of Medicine in Grenada in the West Indies and has 25 years of experience in the field of infectious disease. Dr. Badaman's been a member of Memorial's medical staff for more than 12 years. He served as a chairman of the Infection Control Committee since 2005, member of the CME and the Critical Care Committee. Dr. Badaman is well respected, by his peers and his community, and his unique passion for community wellness. We're very pleased to have you here this afternoon, Dr. Badaman. Thank you.
Thank you very much.
Thank you. Our health department is getting a lot of questions, and I know the Department of Public Health is, and folks out there are really concerned, and they want to do the right thing, and we're getting a lot of questions about what can I do to protect myself, and do I need to get tested? Can you help us out with that?
Okay. Protecting yourself, Mr. Kerman has really emphasized on hand hygiene, social distancing, and if you're sick, not to be working, not to be out in the community. This virus is mainly transmitted through droplet and touch. So close quartering and close distancing is the highest risk factor. Concerning the testing issue, we have good tests that's out there. Unfortunately, there is a limited amount of testing kits available at this point. So we have to initially use this for people who are acutely ill that are showing signs and symptoms of infection and needs to be tested for this COVID-19 virus. So a screening test at this point for somebody who's not ill or who's concerned about it is not going to be helpful. It's a waste of resources for people who think that they may just need to get tested to rule out that. I have been asked by patients that have no symptoms, but they just came from another country, and they want to be tested and vetted out saying that you don't have the illness. In that case also, it's not helpful. Typically, the test is best when you have the symptoms and when you have developed the illness. So testing is only available for people who show clinical signs and symptoms of the infection.
So how would an individual, what would you recommend to the individual if they're starting to show signs and symptoms? Call their provider in the process for that, sir?
People who show signs and symptoms of flu-like symptoms, fever, muscle aches, cough, sneezing, headaches, typical symptoms of an upper respiratory or a lower respiratory tract viral infection, they should get in touch with their primary care physician. And the primary care physician then can vet this out with the health department, and they can direct them where they can be tested and how that can be done. One thing that I really want to emphasize is do not overflood the emergency room just because you have a little cold or symptom. Because the emergency room have a lot of patients that they have to take care of. If everybody who had a little cold run to the emergency room, we will not be able to cope with the care of the community.
Right, very good. So the key message there, if you're starting to have symptoms, make sure you call your medical provider or the emergency room first.
The medical provider would be the best thing.
Okay.
And the medical provider then can, in conjunction with the health department, determine whether you need to be tested or not. If you do meet the criteria for testing, they will direct you where to get tested. And I know there is this question that's out there, where do we get tested? Some counties or some states have already have this drive-through testing.
Yes.
Are we doing that here? We are. I'm speaking from Memorial Hospital, and I'm sure St. Elizabeth Hospital, which are the two largest hospitals in this area. They are planning to get a drive-through testing. I am hoping it will be up and running by next week. And once we have those information, it will be disseminated through the health department and to the St. Clair County community.
Very good, very good. As we said earlier, the numbers have jumped so much. They went from 180 cases in Illinois to 288 in one day. Can you explain how that happens, and again, how a person may not show symptoms, but they can be asymptomatic and spread it in the community? Can you kind of explain that a little more, and the need for social distancing?
Yes. You have to remember that 80% of the population that ended up getting this virus may have a very mild symptom and may not be as sick, especially if they are young, if they are healthy. What we saw from the data that are coming out of China, out of Korea, and Italy, about 80 to 81% of the population actually may have a very mild symptom, and they may recover from it. Children may recover very quickly from it and may not even have that much of a symptom. So there is that risk that people are going to be shedding that virus after they get better. So in an ideal situation, if this was an ideal world, everyone who had respiratory symptoms would be tested and vetted out. That would be the best thing. But unfortunately, reality does not dictate that. So the reality is that we have to test the people who are sicker until we have enough test kits to do more and more people. So as we test more people, we are going to discover more. So for people who have that mild symptom, and the young and the healthy, which is normally in the working population, if you are ill and you have signs and symptoms of a respiratory tract infection, stay home. Keep away, keep your distance from other family member or from work. That's very important. That actually would decrease the rate of spread of the virus. So the main concern that we have is that 10% of the population that are the elderly, the immunocompromised, when they do get this virus, they do get very sick. and from what we have seen from data coming out of China and Korea. And that's where the mortality rate is much higher. That they can end up in the intensive care unit, they can end up in the hospital for a prolonged period of time. And if you look at what's happening in Italy, the healthcare system was literally inundated from these cases. So I think it's the whole community's responsibility to prevent this virus from spreading very rapidly and very quickly and ending up in the most vulnerable part of this community, the elderly, the immunosuppressed, people who are on chemotherapy, who have cancer, who have AIDS, who have emphysema, who have congestive heart failure. That's where the virus is very deadly. So for the general community who are healthy and young, clean your hand. I don't know how much I can emphasize about cleaning your hand. Clean your hand regularly. Alcohol, 60% or more alcohol concentration is excellent at sanitizing the hand. Soap and water, whether it's antibacterial soap or regular just soap, the bar of soap, cleaning your hand with that is just as effective.
Excellent.
Avoid touching your hand. Touching your face, excuse me. And that's the most important thing that we can message. And if you are ill, please stay home.
Very good.
It's very, very important,
Very good. Anything else you would like to add, Dr. Badman?
All I can say is I think it takes the whole community to fight this virus. It's a novel virus. It's a learning process. There is no medication out there or vaccine that's out there at this point. So the only thing that we're left with is prevention, prevention, prevention. And I think the most important part is cleaning your hands, avoiding community contact, avoiding large gatherings, and if you're sick, staying from work, you would do a great service for the community.
Excellent. Well, Dr. Badman, we truly appreciate you coming here today and helping us. I know you're one of the best infectious disease doctors, and we have several very, very good doctors in our community, but you're well renowned, and we truly appreciate it. Thank you, sir.
Thank you for this opportunity.
Okay.
Well, there you have it. You've heard from our guests today. I want to thank Barb once again. I know you've been burning the candle at both ends, and Doctor, I really want to thank you for taking the time out. I know you're a very busy individual, and to Chairman Kern, who has been day and night dealing with this. Just a few more things. What we're doing at the EMA, the staff here has been in contact with all of our first responders today, compiling more list. We've been doing that for the last couple of weeks, but we're updating that. We sent out an email to all of the police chiefs and fire chiefs, getting the exact count on some of the PPE equipment that they're going to be needing and getting more requests put in. Tomorrow, Chairman Kern and I have scheduled a conference call to meet with all of the local mayors by phone in case they have any questions or updates that they may feel that they need. Barb will be joining us with that also. That will take place tomorrow morning at 10 o'clock. But I just want to thank all of you followers. This is the best way we can get the information out to you to reach the most. Chairman Kern is coming up with some other ideas of wanting to make sure all of the citizens in St. Clair County are getting this message. So we'll be updating you on that. We appreciate you joining us today. We'll be joining you back here in just a little bit with our young ladies to relay a summary of this to our Spanish community. So again, thank you, and we'll see you tomorrow at approximately 3:30. Thank you.